So my name's Jamie Huff. I'm a clinical pharmacist here at Sinclair Health Clinic. I'm here about 3 days a week, give or take, depending on the week. And I also work at Shenandoah University at the School of Pharmacy, and I'm an assistant professor there. Absolutely. It is a tricky topic, but one I think we have to talk about. So food, as you said, is central to a lot of people's culture. It's central to the holidays. We usually gather around the table. So it's important to be kind of having a plan in mind when you're going into that. You know there's going to be food there, and you know what food your family typically has. Like you said, many are not good for patients with diabetes, but it doesn't mean you can't enjoy them in moderation. So that's one of my biggest tips, is to think logically and rationally about what's going to be at the table and how you can get yourself to enjoy those things in moderation. So I recommend, if you have one dish that you love or a couple of dishes that you really love, make sure you save room on your plate for that. Now, still don't go overboard if possible. That's where your blood sugar will definitely spike and you'll have some problems. But if something is your favorite and you only get it that time of year, make sure you save room for that. You're going to have that craving on that day, and it's illogical to plan that you won't be able to have that on that day. You're going to give into the craving when everybody else is eating it. Some of those other things, try not to give in to the pressure of eating every single thing on the table. So if something isn't necessarily your favorite, don't eat it. Save room on that plate for the things you really love, and really try to balance it as much as possible. So there's something in diabetes training that we call the plate method. It's something I recommend using all the time, but it can be especially helpful when you're at gatherings where you definitely can't count your carbs, or you can't count how many sugars you're about to have. So when you look at your regular sized dinner plate, imagine that it's cut in half. About half of that plate ideally is some kind of vegetable, a good healthy vegetable. It's not starchy. Lots of people have green beans around the holidays, Brussels sprouts. Any kind of non-starchy vegetable can go over there and take up about half your plate if possible. Then that other half we cut into another half, so quarters. And 1/4 is where you want to put all of those carb-rich foods. Your mashed potatoes, sweet potatoes, corn, all kinds of things that are going to bring your blood sugar up. Bread, pasta, those kinds of things. And then that other last quarter of the plate could be your meat. Any kind of protein that you're going to be having at the meal. So you may not be able to stick to that exactly on the holidays, but it's just kind of a guide to keep in mind as you're planning your plate and as you're grabbing things. Absolutely. If you feel comfortable enough talking to the host of wherever you're going, just letting them know that you have some health concerns and it's something you're thinking about, maybe even offering to bring a dish yourself that you know will be good for you to eat, something you can share with others certainly, but also, it's just that one dish that maybe if I really want seconds and I've had those good things I love, but I'm still not quite full, I know I can fall back on this staple that's going to be good for me. Or working with the host to see if there's something you can do to make sure that there are good options for you, as well as the things you really love to eat. So it's a good distinction to make, and also a confusing one. All pharmacists are clinical in nature in some way, shape, or form. Your pharmacist at your local CVS, for instance, does lots of clinical things for you all the time. So the distinction that most people would make between a regular pharmacist and a clinical pharmacist would be that a clinical pharmacist sees their patients either in an office type setting or maybe in a hospital, going on rounds from room to room. So they're really providing more of that direct patient care rather than dispensing medications. Happy holidays!